On the Benefit Yourself series today, we're going to be talking about mind over bladder. I'm Dr. Adriana Potter, the author of Physical Health. Did you know that about over 50% of the women have some sort of bladder issues? And about 13% of men have bladder issues. And about 60% or more of the people with back pain have bladder issues as well. Well, you might go to your doctor and say, hey doc, I'm having issues with my bladder. And they will tell you, well, what do you expect? You have babies, you're getting old, it's normal. Guess what? It's not normal, okay? So let's just stop saying it's normal because you have babies or you're getting old, because it's common. Common and normal are two separate things, right? It's common for women that have pregnancies to have urinary issues, but most of the time it resolves within 3 months postpartum. And if it doesn't, you need pelvic floor therapy, okay? As you get older, your pelvic floor muscles will change. The change in hormones will affect your bladder and your pelvic floor muscles. So it's common to get some bladder issues, but it's not normal. Nobody that gets old is peeing in the pants, right? Nobody that have kids who pee in the pants. Some women have more issues than others. But before we go over about getting the control of the bladder, let's understand the relationship between your pelvic floor and your bladder. Well, I have here my Susie, right? I call Susie my pelvic floor model. And here it is your pelvic girdle, all right? The muscles on the bottom, they form your genitals. And for men and women have the pelvic floor. They just have different shapes. But the anatomy in general, the muscles, they're all the same. They contract and they relax, right? And if you look in inside, it's a little bit out of position in here, but for a woman, we have the uterus right in the middle, the bladder right in the front, and all the way in the back over there is your rectum, okay? I'm gonna take some of the organs out so you understand a little bit of the relationship. Here goes your uterus and your ovaries. So if you have a hysterectomy, you don't have this anymore, but you have the bottom part, which is called the vaginal canal, okay? But if you look inside here, you can see a little bit more clearly about the pelvic floor and the bladder and the rectum. Oops, there it is. I think you can see it better, all right? In a normal person, okay, your bladder is always relaxed, accommodating for the fluid that your kidneys are filtering. And your pelvic floor always working to support these organs that I just discussed with you, okay? So the pelvic floor muscles are responsible for bowel and bladder control and sexual appreciation, okay? So when your bladder is full, right, it will tell you, hey, I'm full, time to go to the bathroom. And you should normally walk to the bathroom, normally undress yourself down, sit down on the toilet. You will relax your pelvic floor muscles and your bladder starts squeezing on you and nice good gush of pee comes out, alrighty? However, when you feel like, oh my gosh, I need to go pee, and you're psyching yourself up, that will kind of get worse. So there's about 3 types of incontinence that we're going to talk about in this video today. We have the urgent incontinence, the stress incontinence, and the nighttime incontinence or urgency, okay? With the urgent incontinence, usually what happens that your bladder, you either train your bladder to warn you to go to pee because you are just doing a lot of just in case, and you're training your body like, hey, I'm a little full, go ahead and go to the bathroom, or wait, I'm really, really full, go ahead and go to the bathroom. So there's 2 different kind of behaviors. So everybody can train their bladder to accommodate for more fluid. But if over time you're getting more of the urgency and your intervals are getting shorter than the 2 to 3 hours, 3 to 4 for the younger people, 2 to 3 for the older, you should, having some issues like gotta go, and you psych yourself up, and then you just like, oh my gosh, I need to go, and you start walking in the bathroom and the pee start coming out, right? So that's the urgency incontinence that you're probably having it. And that means your bladder is actually squeezing on you before you got to relax your pelvic floor muscles because you're sitting down the toilet and it's a good time for you to urinate. So when you're psyching yourself up and you rush into the bathroom and you're just doing that kind of potty dancing kind of thing, that's actually making your urgent incontinence worse. The other type of incontinence is the stress incontinence, which has to do with the control of pressure in the abdominal area and the recruitment of your pelvic floor muscles, right? So when you cough and sneeze and laugh, or have a physical effort like lifting or something like that, you have a little exertion, and that disturbs the pressure here in the abdominal area. And if you don't do a good control of the abdominal and the pelvic floor, you will bulge not only in abdominal muscles, but you're also gonna bulge downwards into this pelvic area. So we're talking about bulging up here in abdominal muscles and bulging down here. And your pelvic floor physical therapist will help you addressing in that. This video is actually to give you a little bit more reinforcement of the information in the gap from a session with your PT, or at least get an idea of what they're going to be talking about. And a lot of people, this is the first time you're hearing about the pelvic floor and your bladder issues. So this is to help you to prepare for that or reinforce you already have discussed with your physical therapist, okay? But when you have this disturbance of the pelvic floor, abdominal muscles and your pelvic floor, and you just don't control that, you will bulge it, and that bulge is going to squeeze into the bladder, and your pee was going to come out because your muscles are not strong or not contracting fast enough automatically, because sometimes that's what's happening. Your muscles are not engaging or too slow to engage. And the last one we're going to talk about, the urinary incontinence at nighttime, is most of the time a lot of people have issues with getting up multiple times at nighttime or having urine loss on the way to the bathroom when they're getting up at night. Well, the normal in general is about once or twice a night to get up to urinate, depending how much fluid you had close to bedtime. And the most important of all is that if you're getting up once or twice, is that disrupting your sleep? Do you feel like because you got up, because your bladder woke you up to go pee, now you're having a hard time staying asleep or having a restful sleep? So that's when we want to address that nighttime voiding, which we call nocturia in our world of PT. And you want to make sure that it's not disrupting your quality of sleep, and you're also having good control when you're attending to nighttime, okay? But in general, when we're standing, the gravity is actually pulling the fluids out, keeping them on your legs and your system, right? And if you are doing too much hydration around the end of the day because you had a busy day, you could not drink the water during the day, so now it's like you're home, you're trying to catch up with your hydration. So you actually end up overloading your bladder at nighttime because the excess fluid from your legs, when you go lay down, they get back into your system, and it will be filtered into your bladder, and it will fill it up pretty fast. And you add that a little bit more of that overhydration after 5 or 6 o'clock at night, it's gonna overload your bladder, so you feel that you better lay down, you need to get up and go pee, or you're going there 2 or 3 times at nighttime and disrupting the quality of sleep. Another reason that it might be because during the day you're having a lot of urgency and you're training your bladder to be very, very, very small. So you're not having a good volume of capacity for your bladder, and you're training your bladder just, hey, I'm full, go ahead and go pee. In the nighttime, that may perpetuate from a little bit what's happening during the day. So how do you fix that, right? Well, simple things we can fix. So let's go over the urgent incontinence. How do you fix the urgent incontinence? Most important of all is kind of take a chill pill, all right? Every time you rush, you will make your bladder behave badly. You will continue to misbehave because your nervous system is overriding that, and it's just like, I gotta go. So if you're attending to that rushing behavior, it will make your bladder squeeze more on you, and you're gonna continue to lose control. So first thing, take a deep breath, take a chill, just like control a little bit your nervous system. When we practice diaphragmatic breathing, which is one of the things that you're gonna hear from your physical therapist, you're supposed to be practicing that every day at bedtime to remind your body of the calming effects that has on your nervous system. The second thing we usually recommend is to do a Kegel. Kegel is the name of the doctor who found that we have pelvic floor muscles and they contract and relax. So the name of the contraction was named after him, is known to be Kegels. So it's nothing more than squeeze your pelvic floor muscles. When you squeeze your pelvic floor muscles, that will tell your bladder, shush, stay relaxed, accommodate for more fluid. versus squeeze, 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 right? The only time your bladder is supposed to squeeze when you're relaxing your pelvic floor muscles because you are sitting in the toilet, all right? So your bladder not supposed to start squeezing until your muscles relax and you're sitting in the toilet, right? So because you're not in the toilet yet and you don't want to rush it, you're gonna do the squeezing of your pelvic floor muscles so you can tell your bladder, shush, just stay relaxed, do not give me that urgency, all right? So after you've done that, you may find out like, oh, yes, that took me a little bit, that urge off a little bit. I can control a little bit more. You might continue to do a little bit of the breathing and you're gonna stand up and you're like, oh my gosh, the urge is back. And you're gonna practice that again. You're gonna breathe, you're gonna squeeze, and there's another one that we're gonna add it, which is the pelvic dance. You kind of like rocking side to side, and then you kind of maybe sitting, maybe standing, maybe on the way to the bathroom. You might have to do that multiple times a day to kind of calm down. And at work may not be ideal for you to do that, but at home is definitely doable. So start on the weekend so it's easier for you to do it, and perhaps by the time you go to work, you should be able to have a little bit more of that control. But those are the 3 things that actually 4 things we should be doing it. Breathing, Kegels, no rushing, and doing the pelvic dance to calm down your muscles. The other type of incontinence that we talked about is the stress incontinence and how we're gonna fix that. So the stress incontinence, like I mentioned, is a little bit of disturbance of that abdominal pressure and the control of your pelvic floor muscles. So we have the control of the muscles and the strength of the muscles that is happening. So everything needs to kind of stay tucked in, bottom going up, belly going in. Because when you cough and you don't control your abdominal muscles, you're gonna bulge, bulge, bulge. And you can kind of practice when you're laying down and you and your hands come outwards, you're bulging. And if you're bulging here, you're bulging down there, okay? So what we wanted to do, I always tell my patients, like squeeze before you sneeze, right? You wanna try to do that Kegel when you're coughing and sneezing and laughing. And if you're not able to feel for those muscles, how to control them, how to squeeze it and then feeling for that, and you probably have to go see a physical therapist. Unfortunately, the majority of the people think they're doing a Kegel are doing the wrong way. Yeah, 70% of the women that think they're doing the Kegel the right way are doing the wrong way. And this is a study, okay? And it's been showing that the women really don't really understand what they're doing it. So we want to change that. We want to make sure that you have got the help from a trained physical therapist that has helped you to identify those muscles and then bringing their awareness of what you're doing wrong and what you're correcting it. Because if you're doing the wrong way, these techniques are not going to work for you, okay? So when you are coughing, sneezing, laughing, you want to brace your abdominal muscles, which is bringing the abs inward. And we have discussed this multiple times throughout the videos on Physical Health channel. And you want to also do a Kegel at the same time. And you want to practice this in different positions. When you're laying down, you have no gravity acting in your pelvic floor muscles. So that will be the easiest way for you to feel for abdominals and your pelvic floor muscles contracting. And you may turn sideways and try to do this movement as well, these contractions of the pelvic floor and the abdominal muscles in the sideways. And then you can sit either with back support or not and try to feel for the muscles. So when you're sitting, you get a little bit more of the feedback from your bottom and your tailbones to kind of lift a little bit when you squeeze your pelvic floor muscles. And if you're not being able to do it right, and if you're guessing if you're doing it the right way, guess what? You need the physical therapist to help you with that, okay? But strengthening those muscles and going to a more advanced position, to standing in, to moving, to lifting, to coughing in the standing position. So you're gonna be doing that gradual progression to maintain control, or if you have incontinence when you jump, when you're exercising. So you need to gradually progress to that. Because if you go to doing Kegels on the table to jumping jacks, you're not gonna have the control because there's too much of a gap between the level of activity that you are having, the leakage, from where your pelvic floor muscle is actually able to contract and maintain the control. So you want to do that gradual progression. And the therapists are the best person to guide you with that and progress you to that level and say, hey, this is how you modify, okay? But abdominal control with the pelvic bracing and pelvic floor muscles contraction, and doing that over repetition in a variety of positions and in functional ways, it will help you with training you to eliminate the stress incontinence. Now, the nighttime voiding or urgency or incontinence, we usually want to control the following way. If you are having good hydration throughout the day and you're not overhydrating after 6 p.m., that will help you. So you want to try to eliminate your fluids after 6 p.m. as much as possible. Your hydration should be happening during the daytime, not after 6 o'clock at nighttime. The second thing, I like wearing compression stockings to keep some of the excess fluid out of my legs during the day. I'm standing all the time, and so I want to make sure that that is one thing that can help you to eliminate the excess fluid in the legs. But somehow it's going to stay in there, and if those fluids are overloading your bladder at nighttime, you want to lay down with your legs above the heart. And I always tell my patients that to lay down with the legs up, really like above the heart, like this, okay? And you have a bowl, or we have over the edge of the bed, or over the sofa. And during that time, you're doing some ankle pumps and doing some circles with your ankles. And that's gonna pretty much, for about 20 minutes, you're doing that. You will kind of get rid of some of the excess fluid that is in your leg, get you in the circulatory system, and get your kidneys, and you're gonna pee out a little bit more before you go bedtime. So you want to start this routine about 2 hours before your bedtime routine. So that way you have enough time for you to get rid of the excess fluid, get it back into your system, and eliminate before bedtime. Another thing that you want to be doing is also monitoring your bladder intervals during the day, because if you're going on a 2 hour or less interval, we are kind of always going to empty the bladder with this amount of volume, and in reality your bladder could really accommodate for a lot more. So which means that at nighttime, if you have a little bit more of the excess, you get to this, which is the 2 hour interval, you pretty much train your body to tell you, hey, it's time to go pee. And that warning is gonna wake you up, and you're gonna continue to happen at nighttime. So if you stretch your intervals during the day, it should help you to increase your bladder capacity for nighttime as well. Okay, so that's one thing to do it. And the other thing that we usually do as a physical therapist, we kind of look in the possibility of having medication side effects. We're not going to change any medication that you're taking it, but we're going to take a look into some of the medications that you take at bedtime or even during the day, and see what kind of effects that may have in your bladder. Because a lot of medication can create excessive urination or urgency or relaxation of the smooth muscles, which are the muscles on the urethra. And very often I have got some patients that have specific medications they're taking it, and they are taking at that time and having urinary leakage only at that time, and it was only a matter of change the time they take the medication. But of course, how do you address that? We tell the patients that talk to your physician about X and Y and Z about this medication, the possibility of you taking something different or taking that at a different time. We're not changing what you're taking and when you're taking it, we just giving you the option to discuss that with your physician, so you can make that change between you and your physician about the medication that is having an effect on your bladder. Well, this is it. This is what the three things that we want to address today: how to identify what kind of incontinence you're having it, and how you can fix that with simple steps that you can take it. And you have to practice that over and over and over and over. I always tell my patients, Kegels are boring. Nobody keeps doing just the Kegel squeeze, hold, and happy with that. They are not engaging. They are boring. So if you are getting to the level that you feel like, oh, I don't want to keep doing this anymore, I always recommend my patients to do the Kegels with simple movements that it will help them benefit something else in the body, and they're more likely to continue doing it. Like I said, do a Kegels when you do your biceps curls, do a Kegel when you're doing a military press. So you can always incorporate those Kegels and abdominal bracing with some of the functional exercises. And this channel has several videos that talks about the pelvic floor and the abdominal muscles, engaging those abs with the Pilates series and the upper extremity and lower extremity series. They will help you to make your pelvic rehabilitation, your home exercise program a little bit more interesting and allow you to continue strengthening and maintaining good pelvic control and bladder control throughout your life. So you don't have to rely on those very pads, like those yucky pads and medications to control your bladder. Always work with your physical therapist. Pelvic floor physical therapists are specialized in pelvic rehabilitation. They have hours and hours of continuing education classes to train themselves to treat several dysfunctions of the pelvic area and the clinical expertise. So the more years of experience for a physical therapist, the more they can deal with complex issues. Always consider the background of your physical therapist and their training, and use their resource to help you to identify the muscles, become aware, and know what your muscles are doing and what to do the right way if you are doing the wrong way, and incorporate that into your daily activities. So pelvic floor rehabilitation is very underutilized, and nowadays physicians are not fully aware. So if you had pelvic PT, blab about it. So always tell your friends, tell your family ones, loved ones, physicians that are caring for you, the benefits that you have experienced from having your sessions of your pelvic floor. This way other women can also learn to empower themselves to control their pelvic dysfunction. My job is here to empower you with information to how to control your bladder, because it's mind over bladder. I'm Dr. Adriana Potter, the author of Physical Health and Let's Get Physical and Benefit Yourself series. I hope you enjoy our video, and don't forget to subscribe and press the button for future videos.